Hello and welcome to today's open listening sessions on the draft accreditation criteria. My name is Liz Weiss, Director of Education at the Association of Schools and Programs of Public Health, and I'm very pleased to serve as today's MC. This is the second of two sessions, and the final one, offered this week, sponsored by ASPPH's Accreditation and Credentialing Committee, and it was created to enable an opportunity for the ASPPH membership to dialogue with each other and with Council on Education for Public Health representatives on the draft accreditation criteria. I expect that ASPPH will have more such webinars over the coming year to continue engaging with members on these important issues. A few housekeeping items as we start. If you look to the right-hand side of your screen, you'll see 5 handouts available for viewing or downloading. First, CEIF's draft criteria. Second, CEIF's draft templates. Third, a tool on competency-based education. Fourth, CEIF's documents on how they derive their criteria and some diagrams on how to operationalize the criterion. That's also available on CEIF's website. And fifth, an illustrative mapping exercise by an ASPPH subgroup which lays out CEIF's curricular elements by the Baccalaureate, MPH, and DRPH degrees and maps them against key domains. While you are in listen-only mode and your lines have been muted, we encourage you to post questions and comments throughout the session by using the chat box located in the right-hand side of your screen. We will spend a significant portion of the session taking your questions and comments after all of the speakers conclude their opening remarks. However, we may opt to address quick follow-up questions after each presenter's remarks as appropriate. Our aim is to engage with you in a constructive dialogue in which any critiques also include suggestions for how to resolve the issues posed. We are recording this session and will make it available shortly afterwards on the ASPPH website. I'm very pleased to introduce our speakers today. Our lead presenters, Dean Richard Kurz of the University of North Texas Health Science Center School of Public Health, and Dean David Goff of the Colorado School of Public Health, a partnership of the University of Colorado, Colorado State University, and University of Northern Colorado. Dean Kurz is the chair of the ASPPH Accreditation and Credentialing Committee through the end of this month. Dean Goff will take over the chairmanship as interim chair beginning September 1st. Our next presenter is Dean Donna Peterson of the University of South Florida College of Public Health. Dean Peterson is ASPPH Chair-elect of our Board of Directors, Chair of the Framing the Future Task Force, and President of the CEIF Board of Councillors. We're also pleased to have with us today in our offices Ms. Laura Racer-King, Executive Director of the Council on Education for Public Health, and Ms. Molly Mulvanity, Deputy Director of the Council on Education for Public Health. Now I'll pass the floor over to Rick. The floor is yours.
Thanks, Liz. I want to first offer my welcome to everyone who's on the webinar today, and thank you for joining us. ASPPH's response has been led, as this next slide shows, by our Accreditation and Credentialing Committee, all the members here from all the schools who have participated with us. I want to thank them for their involvement in this process. I also want to thank Liz Weiss of the ASPPH staff for her unending leadership and support of all aspects of this review process, as you will see, that we have conducted. And this process, which began last March at the ASPPH meetings, is continuing. Dr. David Goff, the new committee chair come September, is going to be carrying this forward through the committee, and he'll do that in conjunction with the board of ASPPH, of course. And Dean Goff will be talking about this a little later in more depth. So this slide gives you an indication of who our ASPPH member counselors are on the excuse me, CEPH council. Some of them are with us today. Obviously, Donna is, and maybe some of the others are with us as well. And if they have comments as I'm finishing up and want to add something, I would encourage them to do that, to make sure that they have an opportunity to provide input into this important process that they have obviously played a role at this point as counselors in developing. Our next slide gives you an indication of another activity that we've been going on. Since April, ASPPH staff have been working with some volunteer groups of members that are listed here on this slide. And we have expressed, and they have expressed an interest in working on this problem and have devoted a good amount of time to doing that. The upshot of their work have been information that has come out, and that information is listed now on the online community site for the association. I'd also like to thank the over 150 members of that group who have joined together to provide this information. It took a good bit of work. Also especially want to thank the leaders who were mentioned here for their hard work in pulling all this together. This has been an essential part of our process and could not have been done without a lot of volunteer activity by this group of individuals. I'd also like, as you'll see in this next slide, to turn to the things that we have been doing and summarize those a bit for you, especially for those who have not been as engaged in the process at this point in time. As you can see from this slide, that things did start, as I mentioned, at the March ASPPH meeting, where we had discussions through the committee and in other sectors about what was going on. That was actually during, I think, that meeting that we received the new proposed criteria. So we were anxious to see that and had an opportunity to chat about it. Next, as I mentioned, there were the 9 groups that came together to provide indeed extensive analysis of what was proposed. ASPPH has been staffing these activities, and you will, as I said, have an opportunity to see what's come of that work on our website. The next is the extensive discussions that went on at the ASPPH sections retreat. Various subgroups there had extensive meetings and again produced reports that or will be available to you to review. I had an opportunity to be a part of the sections retreat and to participate in those discussions, and I can assure you they were intense and thorough and wide-ranging, and tried to cover many of the important issues that we need to address in reviewing these criteria. And then finally, at the leadership retreat, the proposed criteria were again discussed in a plenary session. They were again discussed at the board meeting, and in both there was substantial interest in what the process was that we would be going through to provide information back to ASPPH on the feelings of our members, and to do that as an organization that has obvious concern for this. We are now in the 2 listening groups. We had one 2 days ago, and the one today. This is another step in this process, and I believe an important step because it brings together not only we as ASPPH members, but it brings together 2 of the key folks from CEPH to participate with us, to hear our thoughts in a broad way, and perhaps to respond to some of those to increase our understanding of what's going on and to help us to create excellent responses to help them to create excellent criteria. This final slide is just a call to action, if you like. We feel that it is absolutely critical that you as member organizations and as individuals respond. It is not a substitute that we as ASPPH as an organization will have a response. You need to do that individually. Please, send those responses to Laura King and Molly Mulvaney. And if you do that, if you do send in comments, we would also ask you, however, to copy us at ASPPH through Liz Weiss, and that way we can take your comments and make sure that they're represented in the common document that we present to CEPH in the future. So with that introduction to things, again, want to thank you for participating in today's activities, and to turn the webinar back over to Liz.
Thank you, Rick. Seeing no questions related to your bit there, we're going to move on to Molly. Molly, the floor is yours.
Great. So I'm going to talk a little bit about the context and history and purpose of this current criteria revision process. So you can see in italics, there are sort of three major goals or priorities for the current process. As you can see, quality, flexibility and innovation, and simplicity. And also, we do understand that there's an interest in having criteria that relate to the organizational structure of schools and programs. So those are all important priorities in our revision process. I think it's also helpful to think about the context in which we're operating. Right now is a time of a lot of change, some excitement and a lot of tumult in public health and in higher education as a whole. I think that there is a high degree of clarity on the proposition that we need change in higher education as a sector, and in public health in particular. The challenge is discovering what that change needs to be and how exactly it's going to shape up. I think another really important trend in higher education is the focus on assessment and outcomes, privileging outputs over inputs. And I think that's another idea that many, perhaps a majority of folks may agree upon at this juncture. The challenge comes in figuring out how to measure outcomes. If we're going to privilege those, they tend to be a little bit trickier to quantify and to measure than inputs are. We know there's been tremendous growth in public health offerings in higher education, and that certainly affects the world in which we operate currently. And the push for transparency across the higher education sector, I think, is an important one. Transparency is certainly a value of CEPH, and that sort of thought about being transparent with students, with employers, with stakeholders is one that is very primary in our minds as we shape the next accreditation criteria. Some CEPH-specific things. Even though it seems like it was just yesterday for some of us, the last major substantive revision to the criteria took place 10 years ago. In those 10 years, there has been a lot of activity, a lot of groups thinking and writing and publishing and discussing what the future of public health is going to look like. Donna's going to talk next about the Framing the Future initiative, which is certainly an important one. But our idea in this criteria revision process is to leverage the work of all of those people who've been thinking and writing about this in the last 10 years. I'd like to emphasize that our 10-member Board of Councillors makes the accreditation decisions that has been shaping this criteria drafting process. I think sometimes there is a little bit of a tendency to picture the Council as an authority on high, making pronouncements that may be challenging to implement. I always like to remind folks that 5 of our councillors run schools and programs themselves, and they are absolutely steering down the barrel of change just as all of you are. They're going to face the same challenges in implementation in many cases, and even for those members of our board who are not running academic programs at this time, I can assure you that sort of challenges in actualizing anything that we talk about in theory are a primary element of our discussion and consideration. The other thing that I really like to emphasize is that we have been taking notes. All of your comments, concerns, feedback, complaints, we track those. And over the past 10 years, we've come up with a pretty hefty list. So when we are thinking about revisions to the criteria, we are absolutely thinking about the things that you have told us. And the simplification goal, that was one of the 3 goals or priorities that I mentioned at the beginning, is directly related to the feedback that we've heard. We've heard you loud and clear, and that's something we're really trying to do with these criteria. So Our shared challenge is to balance the 3 priorities or goals that I talked about in the first slide. So in many cases, folks tell us that it's very challenging to interpret accreditation criteria. Do they mean this or do they mean that? Is this allowable or is that allowable? I suppose it would be possible for us to write a set of criteria that were very simple. They would tell you exactly what qualifications your faculty should have. They would tell you exactly what courses to teach and how to do them. That would clearly be a major inhibitor in flexibility and innovation, which we know is important to you and is important to us. We also have to balance quality with simplification. And the desire to make things clear is not always compatible with the desire to ensure that we have an appropriate bar, an appropriate floor that explains the minimum, certainly, that we expect in public health as we work toward continuous quality improvement. The other thing is that sometimes flexibility and innovation have to be balanced with quality. So sometimes I think the role of criteria is that we do have to say, no, that's not going to work, or this is the bar, the line that we're going to draw. We know it's a balancing act, and we want to allow as much flexibility and innovation as possible while still ensuring that there's a basic level of quality maintained. Here's another perspective on balancing those 3 priorities. This is the classic engineering triangle with quality, cost, and timeliness. And folks say that you can get 2, but not all 3, and you have to balance them. I would like to say that our goal is to get all 3 as best as we can, but it's always going to be a challenge to do that. So what's going to happen next in the process? Well, we are taking your comments, and we, as you know, the comments are due on September 18th. We're going to look at all of those comments and produce another draft for you. So you are going to see a new improved draft of the curricular criteria that reflects all the feedback that we get. Those are coming out in November. We're also going to be releasing the full set of criteria. So criteria that address all of the aspects covered in our current criteria, and you see them listed there. So those will be joining the curricular criteria. And when we release all of that, there will be a second comment period. You can see the timelines there for comment periods that follow. I like to emphasize that we are in comment period 1 of what will likely be 4 comment periods. So we are in the early stages yet, but we do intend for each process to, it will be a very iterative process, and we intend for each to build upon the previous ones. And we hope that these will get better and better. And the way they're going to get better and better is through our process and through a lot of dialogue. And today is an important component of that dialogue.
Thank you, Molly. Next up is Donna. The floor goes to you, Donna.
Thanks, Liz. If I can have the first slide, please. I think, as you've already heard, this process has been informed by a number of activities and efforts, and certainly by a lot of discussion over a number of years, and particularly those that took place under the task force that we created in 2011 in response to all of the changes that were taking place, both in our field as well as in higher ed, and we really wanted to take a step back and think about what the future might hold for our field. And when we looked at the calendar, we realized we were coming up upon 100 years after the Welsh Rose Report, and we certainly know that things have changed a lot since then, and so we set out to make 2015 the year when we would chart a new course. And if I can have the next slide, we were intentional from the very beginning, and I always give Barbara Reimer credit for this. She was on the committee that created the task force, and she said, I think it's really important that we step back and take an empty room approach. And what she meant by that was not to look at what we were doing now and make some changes around the edges, but to really step back and say, in 2015, where is public health? How does public health fit into higher ed? What is the role of our schools and our programs to prepare the professionals who will carry the work into the years to come? And we took a very concerted effort to try to do just that, and it's hard to do, but it is the spirit with which all of the task force activities were carried out. So if I can have the next slide, you'll see there were a variety of approaches that the task force used. The task force itself met either in person or by phone. The task force was large, so they impaneled smaller groups of people to focus on 6 specific tasks, and all of those reports are on the ASPPH website. We enlisted the input of a blue ribbon employer group because it was very important to us that we hear from that group. We had a web page that we put everything on, so all the meeting minutes, all the discussions were on that page. On that page was also a blog where we posed questions that people could respond to. And at every ASPPH meeting over 3.5 years, we had lots of discussion about where we thought the field should go. And in the middle of the slide, you'll see that we also made presentations at meetings. Those were cases where we would submit abstracts and be asked to come to the meeting to present this. And then we also went to town halls. Wherever people would invite me to go, I would go, and we would have very spirited, very creative conversations about where we thought this should all be. And if you see the next slide, you'll see a map of where I traveled over the past 3.5 years. So you can see the folks that either invited me or where we went to present. We had great crowds. There were thousands of people that engaged, and a lot of the ideas that you see expressed in the expert panel reports were informed by these discussions that took place not only at the national level and at the level of the task force, resulting in all the expert panel reports, but also, because to me it was very important that people within schools and programs really start to think about what this change might mean for them. So I think it's important to note that what you see in the proposed criteria now, what you will see in the proposed criteria to come, have been informed over years of dialogue and discussion, and people being creative and trying to think toward the future in a spirit of change. And if I can have the next slide. When we concluded the Framing the Future work, we exploded the frame, you see. So all those dots are all of the great ideas that are to come. This is a process. And if I can have the last slide, you'll see that there is confirmation of what you see in the proposed criteria that have been released by SEAF, which are that's on the left side of this handout. This is something you can access through the handout page. But you'll see that other groups who've put a lot of thought into this have come up with the same kinds of areas. You'll see our employers panel, the council, the MPH expert panel report, and then more recently, the NBPHE conducted a job task analysis, so people actually out in the field reported back to the NBPHE on the types of job tasks they engage in. And you'll see there's a lot of confluence here. And that was absolutely reflected in all the conversations that I participated in, and I think it just really it gives support for where we are heading. And I'll stop there.
Thank you, Donna. And we'll move on to the anchor for our formal remarks. The mic's yours, David.
All right, thank you. I want to start by thanking everyone who has joined us today, and also note the strong contributions of the Accreditation and Credentialing Committee, Liz Weist, and our staff at ASPPH, Laura, Molly, and all our SEAF colleagues, Donna Peterson, and all the people who participated in the Framing the Future initiative, because that's really set the stage for where we are with the accreditation criteria. I also want to thank Rick Kurz for his able leadership of this effort to this point. He's leaving some pretty big shoes to fill, and working with all of you, I hope that I'll be up to the task. On this slide, what you see are the next steps in bringing home our responses to the draft curriculum criteria. So we are having the second of 2 listening sessions today, and we're going to rapidly move to the listening part. After we get your feedback, we'll add that to the feedback that we got earlier this week and draft a response to SEAF that will be reviewed by various bodies within our organization, our Accreditation and Credentialing Committee, a focus group of additional individuals that we have pulled together to represent other perspectives on these issues, and finally the deans and primary representatives of the programs. That's a lot to get done between now and September 18th, so if we call on you to provide feedback, please try to get it back to us as soon as possible. And also please understand that this is just the first of several rounds of comment and feedback, as you've heard earlier today. So if we do miss the opportunity to get your feedback or someone else's feedback in this round, there will be other opportunities to provide that feedback in the future in subsequent rounds. It's also important to know that at this point our focus is going to be on capturing broad curriculum-specific recommendations with granular comments included when they may represent reasonable and high consensus solutions to the issues that have been raised in the broad recommendations. So this is not really a time for a lot of wordsmithing. This is a time for broad input. The next slide shows some of the areas that we have heard about already from people who've commented, including the session a couple days ago, but even before that. First is there's been widespread support for really raising the bar for public health education and advancing our field to make it relevant and increasingly relevant, and that underlies and supports the entire Framing the Future effort. Some of the issues that we've heard about, and we look for your input today on these and other issues, have to do with the knowledge, skills, and attitudes that are identified in the draft curriculum criteria. In the past, institutions have been able to identify the competency model of their choosing. In this iteration of the criteria, specific knowledge, skills, and attitudes are identified as a floor for the curriculum for accreditation purposes. We're interested in your input on that. How to connect the 5 core areas of public health with this more integrated approach. We have some ideas about that. There's been a lot of discussion that may come up today. How to make sure that the public health identity is not lost in the effort to strengthen our focus on leadership and professionalism. How to distinguish the degrees from one another, the baccalaureate, the master's, and the doctorate in public health. In particular, there's been a fair amount of discussion around the criteria for the DRPH. That may come up again today. And then flexibility and specificity in the criteria. As you've heard earlier, we want to have flexibility, but at the same time, specificity and assurance of quality. Some concerns have been raised about the perception of the amount of documentation that's being required to support these criteria. And we're interested in your thoughts about the flexibility and the burden of the documentation, and whether it appears that the documentation links to our goal of assuring quality in teaching and learning. And finally, some comments have come up around the products that would be required for students to produce and for schools to document related to the integrative and practice products, the practicum and the capstone. So let's move forward. I think at this point we're at the stage of the webinar where we're particularly interested in your input. We have some questions that have come up previously that we can address, but we're also very interested in hearing specifically from you. So, Liz, I'm going to turn it back over to you for this section.
Thank you, David. So I encourage all those on the line to type in your questions. I see a few have come in now. We're going to go first to the questions that came in during the registration period. We invited your questions and comments at that time, so we'll give those precedence. And the very first one, I'm really happy this truly was the first one, is I think the question we've heard the most from across the board, all constituents, and that is, you'll see it there on your screen, how do skills align with competencies in the new framework? And I would like to respond first with some framing comments about, to try to answer it, using a tool on the ASPPH website. It's also one of the handouts there on the right-hand side of your screen. So as Molly mentioned earlier, competency-based education is pushing our faculty to focus less on what we do, what we teach, and more on what our students get out of their time with us. And our approach in this method is to focus on enabling our students to acquire demonstrable and measurable abilities. In looking at CEIF's draft curricular criteria, the question is, what are the basic abilities or floor that we could all agree on that our students need to acquire in each of the degrees that we offer? So while in school, students perform discrete tasks to demonstrate their learning. These tasks are the building blocks of more complex bundles of competencies that students, come graduation, will demonstrate when they're in the workforce. Employees have to perform more contextualized, complex tasks that enable them to fulfill their job, their role, or their function in the workforce. Bloom developed a helpful taxonomy in 3 domains, and all human abilities, no matter what humans exemplify, fall into these 3 domains, more commonly stated as knowing, doing, and feeling. We're going to look at each of these 3 domains right now. So first, the cognitive, or the knowledge, or the knowing domain is really information in one's head. Professors are most comfortable with this domain. We've all largely been taught from this model. The knowledge domain includes abilities with facts and figures, theories and conceptual frameworks, and/or metacognition. An example includes specify environmental risk assessment methods, or to use a question taken from a CPH practice exam, which of the following statements best describes an intent to treat analysis? Next, the psychomotor domain covers operations that could be both mental or physical, both bodily and sensory actions. While our clinical partners may take a pulse or examine the oral cavity, we in public health may calculate basic epi measures, or communicate an organization's mission to stakeholders, or conduct a rapid disaster health needs assessment. Notice the verbs. Each of these competencies, regardless of the domain, knowledge, skills, or attitudes, need to have verbs to make it a competency. Third, the affective domain holds our feelings and attitudes, which themselves are mediated by thoughts, experience, and our aspirations. They include motivational dispositions, perceptions, values, and opinions. We display our attitudes in what we say and do, and also what we don't say and don't do. This domain is often misunderstood and is the least appreciated among faculty. However, attitudes are powerful drivers of behavior, and as such are important components of learning. Examples in public health include value lifelong learning and professional service, or commit to advancing population health. I'm going to go back to the question and turn over the further answering to Molly.
Yeah, absolutely. And I love this question, and I absolutely love Liz's explanation, very eloquent. Let's go back to that model. If you notice those bottom 3 boxes, knowledge, skills, and attitudes, which Liz just talked about, our criteria are written in their current format on the draft. The draft format is written in the domains of content, skills, and professional disposition, which line up pretty nicely with those 3 boxes. What's funny is that we certainly weren't looking at this particular slide or model when we were developing the draft criteria, but these are very sort of commonly held and used models, regardless of the terminology associated with it, throughout higher education at this point. So we do think that the criteria that we have put out for comment certainly align with the idea of competencies that we've been advancing, and we like to think that we are, to use a sports analogy, moving the ball a little bit further down the field in being a little bit more specific about the competencies in this particular iteration of the criteria.
Thank you, Molly. I'm going to move on to the next question and continue sending us your questions using the chat box, please. Number 2, how will the new curriculum impact the job market? And Rick, I believe we're turning to you on this one.
Yep. A couple of things that I would say, Liz, in this regard. I think probably the most initial thing to say is that it's really probably too early to tell. I mean, we are just beginning this process. We have not finalized the criteria through CEPH, and so I just think it's a little early to tell. Secondly, I think everyone needs to understand that employers did participate in shaping what was done with the Framing the Future activities that went on through ASPPH. We had employer input into the NBPHE's job task analysis. So it has not been the case that employers have not seen or had an opportunity to contribute and comment on the places that we have been going with regard to moving, I think we feel the profession forward over the last couple of years, and that are now becoming reflected, I think, to some degree in the CEPH proposed criteria. And then finally, I guess I'd say that, you know, we are going through this process of review with hopefully everyone in the field of public health and the programs in the schools involved. We're going to be amending or making suggestions for amendments to the criteria, and as we do that, we will hopefully make them as entirely appropriate as we can in this process. And I think in doing that, we will be preparing students for the future. And so we'll have, if you like, employer input, academic input, and together, I think, you know, we will be preparing students for a job market in which they can have an impact.
Okay, thank you, Rick. And we're going to move now on to a question, the only question we were not able to answer 2 days ago in the open listening session. It's a really good one. Here it is. If we are going to train the next generation, at least at the doctoral level specifically, and maybe masters, we must train our future professors of public health to teach effectively. Where does teaching skills fit in? And Donna, I'm going to ask you to answer this one, please.
Sure. Thanks, Liz. And it is a great question. And it does appear, if you look at, I'm not sure exactly what the number is, but if you look under the DRPH skill set, you should find it there. And it's there because this was one of the themes that really was woven through nearly all of the town halls, all of the presentations. This came up over and over and over again, both in the context of we have the opportunity now to train the future professors to teach, and not just to teach in our traditional programs, but in this growing array of programs that that we have seen out there. It also was a topic of some discussion, and in times heated discussion, during the DRPH expert panel. There were some very passionate people who believed that it was absolutely critical that DRPH students be prepared to teach as students, and you will see that in there. And I should say, when I say it was they were often heated discussions, it wasn't that people didn't think that DRPH students should learn how to teach and to have some time in the classroom. It was more the concern that we didn't want the DRPH to have requirements that the PhDs did not. And in fact, I don't believe we put this into the PhD criteria, and there's a lot of reasons why we didn't do that, but it is in the DRPH criteria now, and I think that's because we felt the need to give voice to what I certainly heard in my travels around the country, that people were asking for this. And I don't know if anyone else wants to say anything about that, Laura or Molly.
No, I think you covered it. Thanks, Donna.
Okay, there are about half a dozen questions in the box, so we're going to go to that right now. And the first one is, the vast majority of my MPH students are physicians, dentists, veterinarians, and other health professionals who will have not taken the courses of a BSPH. How can the newly formulated MPH accommodate these students, or will they have to consider other graduate degree programs? Molly.
Absolutely. I want to make a couple of points about this answer. The first part is the premise of the BSPH classes. We actually, as most of you know, released criteria for standalone baccalaureate programs just a couple of years ago, and we incorporated the curricular elements of the standalone baccalaureate programs into the criteria that are currently out for review. Those criteria were drafted around the critical component elements identified by a work group that had a lot of input and consensus, and the curriculum for the bachelor's degrees that CEPH has sort of gotten behind in this approach that we are backing is very flexible, intended to accommodate a variety of degree programs that look and operate very differently and train very different types of students. So that's the first concept. I sort of want to refer to the fact that the concept of a BSPH curriculum is probably not as simple or monolithic as the question may suggest. The second piece of the response that's really important is our criteria absolutely were not written from the perspective that one would have a bachelor's level training in public health in order to enter the master's degree that we have described in these draft criteria. That is, in fact, the criteria were written to be accessible. One of the main concerns, and this was raised in the MPH expert panel, is that we believe that the diversity of schools and programs that we have now and the diversity of the student populations that they serve is something that is fabulous and that we intend to continue to foster, and that goes back to our sort of innovation and flexibility principles. So we intended to write a set of criteria that would accommodate a great variety of backgrounds in students and a great variety of different schools and programs, and we would love to hear suggestions on how we can continue to sort of support that diversity.
Thank you, Molly. This next question, David, this will go to you. Would it be reasonable to add cost efficiency to simplicity as a sub-guiding principle? Actually, by sub-guiding principle, perhaps it goes to Seif, actually. I'll start with Seif, and then David, if you'd like to respond as well.
Absolutely. I think that's probably a comment directly related to the principles that I had on one of those introductory slides. Sure, we absolutely see simplification as aligned with cost effectiveness, and yeah, I think those two line up very nicely, we hope.
So this is David, and I certainly agree with that. I think one of the major issues that we would like to make sure stays on the table between ASPPH and Seif is the burden on the schools and programs for collecting and reporting the data that go into the accreditation process. And so things that are highly linked to our goal of assuring quality in teaching and learning are important and valuable to collect. And if there are things that are not well linked, then they may provide opportunities for streamlining. So that's something that we should have continued discussions about. I'd like to follow up on the previous question about the baccalaureate trained students and those who come in from the other health professions. One of the not necessarily directly related to accreditation and the curriculum criteria, but something that should be on our radar screen long term is the idea of identifying or developing ways to allow students to test out of particular areas where they have already taken significant coursework and mastered knowledge, skills, and attitudes. That's something that I think is going to become increasingly an opportunity for us, both with respect to students who come in with previous training or from wherever, whether it's previous degrees or other health professional degrees. Liz, back to you.
Great. Thank you both, Molly and David. Here's another good question, and Don, I think you may want to take this one, give you that choice. Since population health is emerging as an important designation nationally, should we include it clearly in our language, and where? Population health.
Yeah, I'll ask my Seif colleagues. They might want to speak on this. I don't know that it's in there or not in there, but it's certainly, I understand the point, and this is certainly something that we're talking about a lot. I don't know, is it in there, Laura, Molly?
Those words are not in there, at least not in that exact formulation. We are very interested, you know, David said at the beginning, it's funny, we aren't interested in wordsmithing at this point, but if there are important concepts, sometimes words are important. And so as we develop, as we articulate content and skills, I think we are very open to hearing ways in which we can articulate those in a way that is forward-looking and recognizes the sort of increasing professionalization and sort of the future of public health. So we would definitely welcome suggestions for ways in which to incorporate that in our language. I don't know the answer to the question where specifically, but I hope some of you have ideas about that.
I think that's a great point. Thanks, Molly.
Thank you both. Here's the next question. Should documentation of institutional statistics occur electronically through CEIF's website? Molly?
Yeah, so this is something we've probably discussed over recent years. It's not tied necessarily to the criteria revision process that we're undergoing right now. One thing that is really, you know, that flexibility and innovation principle, we have a lot of flexibility in our criteria and in the way we collect and report data because we believe a primary principle of our accreditation reviews are that they are context-based and that they are mission-based. And therefore, it's very difficult for us to collect meaningful statistics that are also helpful in the way that we want to be in the accreditation process. Now, ASPPH as an association has made some moves to collecting some data and reporting some data in their data center. I don't know if any of the staff want to speak more about that, but within our role at CEPH, I think the kind of data that we get would probably suffer in some ways in their quality and may, in fact, challenge our ability to do the types of context-based reviews that we do if we were focused more on making comparable data that could be published and sort of looked at side by side on something like a website.
Thank you, Molly. This is kind of a partner question. Can we explore aligning the assessment requirements with those of regional accreditors in terms of both scope and scale? Now, this has come up amongst our academic affairs section representatives. This summer it was raised as an interesting issue. And I would like to report, Molly sort of queued this one up, that our data advisory group and staff are working hard to align a number of different categories of data. So, of course, starting with the ASPPH data, aligning it with what CEIF collects, with what SOFAS captures, with what the National Board of Public Health Examiners is tracking, and with some federal agency data, namely IPEDS. And I believe there's one more category because there are 6. But as far as the regional accreditation, that would be wonderful to have it spiraling up to that level. I'd like to open the floor and invite our CEIF colleagues, Laura, to respond to that.
So my response to that is I think that that's a great idea wherever it's possible, for sure. And if whoever asked the question, we would be really happy to hear any specifics that you would like to submit to us on that. I think that the other kind of piece of that is that some of the assessments that regional accreditors are doing and the things that regional accreditors are looking at are at a level that is not the same as the level that we are looking at in the profession. So some of those assessment artifacts might not line up very well just because of the type of the element that's being assessed. But I think in the cases where they do, that we would be very open to looking at that and would be happy to hear your thoughts about it and try to apply that to our context.
Great, thank you, Laura. Next comment. First, thank you for the summary, it's helpful. And the person goes on. As I worked on the DRPH work group of academic affairs section reps, I'm wondering how specific do the criteria need to be a la Bloom's taxonomy to differentiate between the MPH and the DRPH? I think we need to do better at this differentiation?
So I really appreciate that comment, and sort of that comment and questions related to it have been among the most common that have actually been raised to us since we've released these criteria for comment. And I really appreciate that. You know, it was a very interesting process that Council sort of undertook in drafting what we put out to you for comment. What we kind of decided in the end is that it made sense to align the domains for MPH and DRPH. We've heard a lot of feedback that folks are interested in articulation between different degree levels in public health and making sure that the degrees sort of make sense and build on one another in a way that is intentional. With that said, what we are trying to do in these criteria is, as I believe Rick mentioned, raise the bar and establish a floor or a baseline so that we can say every student who graduates from a CEPH accredited MPH or DRPH program has certain skills, they're familiar with certain content and have certain professional disposition. So that's sort of the motivation. What we did was we intentionally made the DRPH skills much less specific and much less, in a sense, you might say much less developed than the ones we specified for the MPH. And that was because we believe that the doctoral education is much more customizable than MPH education. The doctoral education is typically tailored much more to the institutional level or even to the individual level. And so that's sort of the reason for the difference, I guess, in specificity with the MPH and DRPH skills. But I think we definitely have, you know, room to grow in our subsequent iterations of that. So really looking forward to comments on that.
Thank you, Molly. Next question. Why does a Bachelor in Public Health have to meet specific accreditation criteria if it was designed as a liberal arts education? Could a CEF representative address the justification for this?
So let me be clear. So here's the difference between schools and programs and what the accreditation criteria requires. If a baccalaureate degree is administered within a school of public health, schools of public health are accredited as a single unit, and thus that degree falls into the unit of accreditation, no matter kind of what the design was intended to be at the school. If it is a public health program, they can designate which degrees fall within their unit of accreditation. So they can opt not to have their baccalaureate degree included with their master's degree, or opt to have it included with their master's degree. So that is one kind of you know, downside, if you will, to having a single unit of accreditation. The other thing that I think is really important to note is that there are already requirements for the baccalaureate degrees in public health in the current iteration of the criteria. We have changed them to align with what we consider to be best practice for baccalaureate public health education. And part of that consideration of best practice was really an attempt to make any public health baccalaureate degree fit within the accreditation criteria. So they were based on the critical component elements that were developed by the Framing the Future expert panel on undergraduate education. And one of the main goals at that time as well was to make sure that both those public health majors that were designed as liberal arts degrees, as well as pre-professional, many of them are pre-professional at this point, and those that are intended to be entry-level practice degrees, that they all would fit within that same framework. And that was a conscious choice on our part. So really, I think any kind of degree could fit nicely within that framework. And we've now that we are looking at applicants for standalone baccalaureate programs, we see that that is the case. All types of programs are fitting nicely with those criteria. So, so we think at this point they're working really well.
Thank you, Laura. We have quite a bit of questions in here, so I'm going to move us along. Next question. How do you distinguish course objectives comparing to competencies? Do we need to map our summative learning assessments to competencies?
So there's a lot of terminology in that question, and you know, I think this is something we sort of need to sort out. As you know, we mentioned the very first question about competencies and knowledge, skills, and attitudes, or content, skills, and professional disposition. There's a lot of sort of confusion about how different sort of terms align, and that's something we need to work on as we continue through the iterations in this revision process. What is intended, the framework in the current draft that's out for comment, require fairly explicit documentation of the assessment of each of the defined skills. That is the extent of documentation of assessment, other than that associated with the practical experience and the integrative experience. That's sort of the sum total of the assessment that's defined by the framework that we have out right now. We certainly expect, this actually relates a little bit to the question we talked about earlier about regional accreditors' expectation of learning assessment. We certainly expect that many programs and schools operate in institutions that use sort of course-specific objectives, as well as whatever the terminology they use based on their regional accreditation to have programmatic level or larger scale objectives. So we anticipate that that will continue. Our criteria are kind of carving out a little space and defining our terms in a little bit of a different way. So I'm not answering your question directly, but I think there will continue to be course level objectives and larger level kinds of programmatic or learning objectives, and I think those two kind of fit together nicely in a building block kind of way.
Thank you, Molly. Next question. How will the new program design prioritize preparing students to think? In your model, cognitive relates to knowledge, but I don't think we want to just confer knowledge, but teach students ways to think. And really, thinking covers all three of the areas you have set out there.
I think that that is sort of an interesting sort of observation, and I think that you know, that these kinds of discussions do inform. I mean, it is important that we have sort of a theoretical or philosophical underpinning to you know, to what we're doing. Otherwise, we end up in all kinds of crazy places with where we go in writing specific criteria. So I think that's a really interesting observation. Just to talk about what is going on with our skills versus our content in the ways that they're defined in the draft criteria, we really sort of put our money, or put, you know, our strongest backing on skills, and then in terms of what we're asking for documentation. However, skills have to be taught in the context of content. It doesn't make sense to teach somebody how to communicate effectively without having something to communicate. And we believe that the content is sort of interlocks with the skills in that fashion. That was the intention in the draft that we have out. The content is where a lot of the public health specific stuff is, and the skills are often things that are very broadly transferable in a variety of professions. And so that's kind of the idea that we had. We also chose intentionally to be a little less specific in the documentation that we require for the content as opposed to the skills. And that relates to our desire to, our simplification goal in this process.
And also our desire to allow schools and programs with specific strengths in very specific areas to make sure that they are able to incorporate their content based on their strengths as well.
And one final point, actually, we listed the same content for MPH and DRPH, and again, that was intended to allow flexibility, since presumably different programs and schools will teach those two levels in different ways, and the doctoral level will certainly be dealing with content in a more advanced fashion than the master's level.
Thank you both for that. Next question. How do you plan to measure / assess attitudes, those professional dispositions?
I think that's a great challenge. I think that because it is challenging, that's sort of one of the things that, you know, I referred to in the larger context of higher education right now. We are all in higher education looking at this. If we agree on the premise that outcomes are really where we want to be going, then how do we measure that? There are some best practices out there, and we're eager to learn more about them. We sort of are new embarking on this as a field, but we took that professional disposition term the actual terminology, as well as some of the organizational, the aspects or the ways it's articulated from the teaching profession. So there are other professions that do this and that have been doing it for quite some time. And so we hope to learn from those examples.
Thank you, Molly. And if I have it right, when we look at the templates for the professional disposition, section C5, we're not asked to submit assessment, but rather all that's asked for in the current template is course numbers and then the components. What are you using? A reading, a lecture, discussion. Okay, next question. Where does innovation fit in, especially in an academic setting, which has historically focused on conformity and competition?
Liz?
Yeah.
Go ahead,
Liz,
David.
this is David Goff. I think I'd like to address that, but first I'd like to get back to the critical thinking skills and just point out that in the draft curriculum criteria, there is mention in several places about teaching systems thinking and critical thinking skills to our students. So I think if there's a consensus that we need to emphasize the importance of that in the criteria, then we would welcome specific suggestions about how to do that. With respect to the innovation, I'll take a stab at this, and then I'd really like to hear Donna Peterson, because I think the entire Framing the Future process has been focused on taking an innovative approach to public health education. And at least as I understand it and as I read the documents, CEF is really trying to make use of those documents and make use of the thinking that has gone into the Framing the Future process to create new criteria for accreditation that reflect the innovations embedded in the Framing the Future process. That doesn't change the challenge of being innovative at an academic institution that might be somewhat resistant or reluctant to change, which I think may underlie the question that came up. Donna, do you have some thoughts on this?
Yeah, thanks, David. And I think your last comment is probably the most accurate. I think it's fun to talk about change and talk about all the great things that we could do if we were freed from the strictures of CEF accreditation, which has not ever been as strict as people like to say it has been. And the Framing the Future effort was all about how do we be innovative and creative and forward-thinking and think not only about where we are now, but where we would like to be. And I heard cries for that everywhere I went. You know, please let us offer the kinds of opportunities to our students that really play to our strengths as an institution, to the demands we hear from the students who come to us, and to the needs of the communities we serve. So when you see moving away from what have been the 5 core areas, that's where that came from. People said, please don't make us do that anymore. Let us really flourish in the areas that we think will mean the most. And I think the task force really saw a world where you had a great variety of program offerings that students, because of technology or because of their interests, their passions, they could travel to any institution that they like to get the kind of learning that was important to them. So I think when you saw early on in the discussion about the CEF criteria trying to create the space for people to be flexible, to be creative in a process that is not necessarily designed to do that is a challenge for us. But I think the bigger challenge is for all of us to say, okay, to manage this level of change will be hard. It'll be a lot of work. And so the criteria also are designed with that in mind as well, to say, you know, you don't have to make sweeping change if you're not ready, or you don't want to, or you don't choose to. That's perfectly fine. I think people can meet these criteria standards, at least this was our intent, within the programs that they have now. Our hope, certainly the hope of the task force, is that people would not, that people would use the opportunity, take the opportunity, and really branch out. That's the goal.
This is recurs. In addition, it might be important to point out that several universities, several schools at least, have already taken initiative in this regard. Harvard and Columbia, certainly 2 examples, have started looking at their curricula even before these criteria came out, and doing more integration around that curricula based even on the other set of criteria, the criteria we have now. And so I don't believe there's any stricture here at all. I mean, about innovation. I mean, we're looking for that innovation, and there's nothing, I think, in the past criteria or the current ones that say you can't innovate in many ways that will provide models to other schools and programs to move forward, as well as that particular school.
Thanks, Rick. I think that's true.
Thanks to the three of you. Next question. Will competencies/KSA still be expected to be crafted to link to the school program's mission and goals, or will they be more universal? Molly.
Yeah, so certainly what the theme that that has come up a couple of times is that the skills, the content, and professional disposition outlined in the criteria are intended to be a floor. And in fact, the criteria also require that schools and programs define additional skills and, if they wish, content that will be associated with their degree. So that's sort of required as a baseline, and we hope to encourage, as Donna was referring earlier, we hope to foster folks in catering to their local populations or their regional populations or the population of their students, whatever population. We'd like to see folks able to develop educational programs that relate to that, and again, sort of freeing ourselves from what is at least perceived as the strictures of the 5 core areas is an important part of that.
Thank you, Molly. Next question. Are there plans to create some sort of outcomes measurement work group to assist in developing measures? So I'll take that one. Rick had addressed the 10 subgroups that have been putting together thoughts and reactions, and this very need, I see very strongly, for a group to look at the data templates and make sure they're evidence-based is a really good point. So that is an area we will be exploring. Next question. Can you comment on the change in terminology from culminating experience to integrative experience? The description seems to fit the previous term better. Wow.
I'm going to be 100% candid. In some senses, we wanted to change the words because we want to encourage people to change their thinking if they want to. And I think you're absolutely right that the spirit of the culminating experience / integrative experience is very similar. The MPH expert panel report sort of maintains the structure that we have now, in a sense of saying, there should be a curriculum of didactic content, there should be a practice experience, and some type of capstone, culminating, whatever terminology we want to use. I think that we didn't choose a word out of a hat. We chose the word integrative for very specific reasons. I think because some of the themes that folks have started to bring out even today about the emphasis on critical thinking, teaching people how to think, teaching people not just how to sort of know what we know today, but how to put ideas together and incorporate the things that we don't even know yet. So I think that the culminating experience and integrative experience certainly, I think the terminology was chosen, I know the terminology was chosen to sort of break us out of the model and allow folks to sort of move on to something new.
I think it's also important to the emphasis that integrative gives on integration, really, because an experience is culminating or at the end doesn't mean it's integrative, and it truly is intended to be an integrative experience. And so I think the word does mean something, and I think it's actually a better description for what we currently mean by when we say culminating experience. I think integrative actually describes it better.
Thank you, Molly and Laura. Next question, and we're going to go back to a prior slide for this one. I don't see ethics on CEIF's list in the comparison chart. Where does it fit in?
It's actually in our content areas. The draft skills only addresses skills, and our content areas do cover some other. So it's definitely in content, and it's definitely in professional disposition, depending on how you define ethics. So those are the ways in which it's incorporated. You'll notice in this slide, actually, that the places, there's that blank cell in the far left column where it looks like there's a gap in skills, but actually almost every one of those concepts identified in the other reports is addressed in our content or our professional disposition if it is not addressed in the skills domain.
Very interesting, Molly. Thank you. Next question. I'm very excited about the concept of flexibility and innovation. Can you tell us some more how the new criteria will encourage that? Flexibility and innovation.
I think we've addressed that question probably in several of the previous questions that were asked. The way that I see it, I mean, I'll answer it a little bit different way maybe than Molly, and this kind of goes back to the mission of the school or program and the populations that it serves. One of the reasons that the skills are written as they are written is because a graduate of a program or a school should be able to apply a skill using any public health content. And so I think that the way that the content and skills are taught within any given program or school could be very, very different and have very different focus areas and allow the schools and the programs to identify and really capitalize on their particular strengths, whether that is urban health or rural health or border health or any kind of global health, any kind of specific application of public health. I really hope to see that developed to a greater extent in the schools and the programs that have strength in those areas, and I think that that would really, really make the offerings in public health in this country very rich and very different, and give students a lot of diversity and opportunity to choose what they want to do while they're learning skills that they can apply later to things they don't even know they're interested in yet.
And I want to make one very literal sort of specific response that Laura was sort of alluding to in principle. We haven't released the criteria on organizational structure or on other elements of other than the curricular criteria, which we intended to be very narrowly focused on curriculum. Our curricular criteria currently blur and have some organizational elements in them, so we're trying to separate that out a bit more nicely. We haven't released those yet. The council hasn't agreed to them in principle yet, but I can tell you with very strong confidence that we are not going to require schools of public health to offer the 5 core, to offer the MPH in 5 core public health knowledge areas as they're defined today. That's gone. And I don't think that's on the table anymore. So I think that's we hope going to be a major driver, that's going to at least free people up in one very specific way.
Which is a nice segue to our next question. Will you continue to require a number of faculty, 5, in each of the domains of public health learning?
So again, the answer, I don't want to sort of scoop myself because we haven't made a decision yet. You know, this actually goes absolutely to my seesaw slides because this is a balancing act. We know that there are certain resources, minimum resources that's necessary to establish a baseline of quality. However, I've just told you that I see no scenario in which we're going to require schools to offer the MPH in the 5 core areas that we have defined for them. So we can't use our old model. It's out the window. It's gone. There's no way in which it's workable going forward. We're going to have to come up with a new model that still ensures that we have quality, and that is in some ways tied to faculty resources. So we're going to have to find a way to sort of describe it and measure it, and in a way that we can't rely on the simple 5 core areas that we rely on now as our backbone. So again, I don't want to get too far down this rabbit hole because we haven't released those criteria yet, and I think it'll be a lot easier to have this discussion once we have something out there. If that something out there is something that you hate, that will be a discussion area for us as well, but it'll be something in writing to react to. So we ask you to hold on till November, and we're going to have much more to come on this.
Okay, thank you, Molly. Next question. In the literature, competency is approached either as ability or capacity. What is CEIF's view on the definition of competency?
I can't say that we have it off the top of our heads here, and competency, as everyone knows, is kind of actually a hotly debated word in many meetings and groups and task forces that I have been a part of. Just saying the word competency gets people all in an uproar with different definitions and different approaches. I would say that our approach is very similar to what Liz presented earlier on the call. And the other thing I have to say that we have also been hearing in the feedback, so comments that have come in and questions that have come in, are the need for more of a definition in the criteria about what we mean, and so that's something that we'll be working on.
Thank you, Laura. This is kind of a long question with some comments, and I'll read it all. What do you really mean by saying integrated learning? As students, we see the need to learn from each other more and to engage in classes that truly focus on application. For example, it seems lacking to have a statistics class removed from the real-world context. So in the future, will something like statistics and EPI be a combined class offering where we don't just learn how to calculate something but know more conceptually why, and to truly take a more holistic, integrated approach to using these skills?
That is such a phenomenal question.
Perfect.
That is a beautiful, phenomenal question, and those are absolutely the discussions. These are the things we're aspiring to do. Now, I'm going to say something. Our current criteria do not preclude institutions from doing this type of integrated learning now. And as was mentioned earlier on the call, there are already some schools and programs that are doing exactly what you've just said, and even more integration than that. So it's possible under the current criteria. We hope it's going to be even more clearly possible and encouraged in our revised criteria.
So yes, we hope so, and that should also be, I assume this question is from a student, and that should also be feedback that students, if they feel that way, you should give that directly to your program or your school, because those are decisions that are made at that level, but we absolutely hope that that's where we're going in the future.
Yes, this maybe just add to there that it is a terrific comment and a terrific question, and it is more difficult to do what the student is suggesting. And you know, we have I think had a little bit easier course when you hire an epidemiologist, a biostatistician, a behavioral scientist, environmental health science, and say teach your area. Don't worry about the others, just teach your area. We're not going to say that anymore, I think, or we're trying not to. And this is a real important innovation that I think these criteria, as they're proposed, help us move towards. So that's a really, really important comment that the student makes.
Well, and if I could add that, those are the kind of comments I heard from students everywhere I went.
And if you are a student, please submit comments. We want to hear from students. I can't emphasize that enough. We want to hear from the practice community. We want to hear from students. So if you are a student and on the call, please submit that comment in writing, because that's something that we need to hear and track.
And if you are a faculty member on the call, please encourage your students and your practice partners to submit comments to us.
Okay, great. We do have a few more questions. We'll try to get them all in. It seems to me the integrative experience does not reference most of the domains of the foundational skills and seems to favor some over others. For instance, communication is specifically mentioned, but not data analysis. can you explain how the experience can be integrative without speaking to the need to include most of the foundational skill domains?
Yeah, this goes back to our balancing act and and our desire to simplify and to allow for institutional innovation and individualization of this kind of experience. We back to the theme of setting a floor, and so we kind of made this decision in the integrative experience. It's not going to work if you don't do a couple of things, and one of those is communication, because Donna can sort of explain that she heard this often in her travels, and during every site visit that we do, we get together with students, alumni, and faculty and practice representatives, and community and practice representatives, and the single skill that everyone mentions as being important and perhaps underemphasized or needed to be enhanced is communication. So we said there's no way we can't put that first and foremost, but still allowing some considerable flexibility. If we need to be more specific, if we need to say, the floor is higher, we need to make sure that the integrative experience explicitly addresses these domains. We'd love to hear that in the comments.
Good.
Can I ask a question about this and follow up? This is David. As I look at the integrative experience criteria for the MPH, it says at least 3 skills related to the student's concentration or generalist degree, which is criterion C3. That would seem to exclude the skills that are in criterion C1 other than communications. Is that purposeful, that as a floor, that we want to make sure there are skills related to the concentration, at least 1 skill that's foundational that's related to communication?
Exactly.
I mean, obviously people
it's
can do
floor.
more. Yeah, so people can do more, right, but this is the floor that must be documented in order to meet accreditation standards if this goes forward.
Absolutely, absolutely.
Okay.
And again, the C3, the concentration or generalist specific competencies are those, skills, are those that we expect to be defined at the institutional and programmatic level. So we are saying, again, 3 is our floor. We expect that many folks will go far above and beyond that.
Right, and so I think the issue is that it would be a reasonable expectation that other foundational skills would be reflected in the integrative experience, but the floor, the requirement, is what's indicated here on those lines 423 through 426 in the curriculum draft, but this is a floor, not a ceiling.
Exactly. Yeah, and they also might be, that's a really good point, they also may be skills, because they relate to the concentration area, they may actually be higher level skills of those same C1 skills. So it really does depend, but you're absolutely right. It will probably address more of the foundational skills.
Okay, thank you. We have, I believe, time if we could do it quickly for 2 more questions here. The next one I'll ask Rick or Donna or David to try to answer this one. If the current 5 cores will no longer be required, how will programs and schools deal with faculty who have terminal doctoral degrees in specific core areas and are tenured?
Oh, I would answer that by saying I'm not sure I see the problem. I mean, I assume that they're talking about folks that have a terminal degree in biostatistics or epidemiology or behavioral sciences, or I'm assuming that's what they're talking about, and who are tenured. These are individuals who, like all of our faculty, should be aware of what's going on in public health and use their skills and talents to help with other faculty to integrate, in order to respond to the new criteria. I'm not sure that I see that that's a particular problem. If the person has a clarification, or maybe one of the others has picked it up, I just don't see it as a problem.
This is David. I'll add a comment that, I think one of the things we've discussed is that the new criteria do not demand change in terms of faculty composition. What they do is they allow schools the flexibility to emphasize areas of local, regional, or institutional importance from a strategic perspective. So I don't see that there's going to be an immediate demand, certainly not from CEF as I read the criteria, to dramatically restructure your faculty or even to dramatically restructure the curriculum. So like Rick, I don't really see a major challenge here, but perhaps someone else does.
Yeah, and I think you're absolutely right. You're both right that what the criteria is intended to do is to allow innovation where people would like to be more creative, and it doesn't demand any change. And just because you don't see those 5 core areas required anymore, if you look at the KSAs that are being proposed here, it's there. And I think that's what, if you go to the handout that maps sort of current areas to what's being proposed, you can see where it all maps. And I would hope that the people in our schools and programs have more talents and more skills and more things that they would like to do, as Rick said. Just because we're not requiring necessarily a single course in a particular area, it doesn't mean that those people don't have anything that they can add.
It might add just one thing there. I think when you have the 5 core areas and people teaching in those, it suggests that they're all equal in a sense, and so everybody gets their 20% of the core or something like that, and so every discipline and the faculty within them are somehow equal in their application. That may change. You may look at what's proposed here and say that you need more input from one area than another in the new your approach to the new proposed criteria, and that will be individual as different schools and programs interpret those and interpret how they're going to address those in responding to students. So I think in a sense, it kind of opened things up a little bit more than just making everything, well, we're going to give you a shot of this and a shot of that, in 5 areas. And so it leads back to that student's question, I think, about integration and thinking about these knowledge areas in a way that broaden the student's opportunity to learn how to apply what they're learning as well as just get the substance.
Great. Thank you all. We're going to move now to our last question, which we actually have in the slide because we knew it would come up, and it's a really good one. And it was asked on this session as well. When would we need to start implementing changes based on the new criteria?
When the Council adopts the new criteria, they will also adopt what we call an implementation schedule. And that's going to define when schools and programs will begin adopting the criteria. And we're going to make that decision in a very tailored way. It's based on the specifics of the criteria as they're adopted. So it's a little bit early to start speculating about that. We have always adopted an implementation schedule when we make changes in the criteria, and I can tell you that the last time, that 2005 major change, it was 2 full calendar years before we started conducting site visits using the new criteria. And even then it was a phased-in approach. So this time around, I think there are folks who are eager for early adoption, and we're going to see what we can do to accommodate those folks. But we certainly are faced with the considerations that we have to train all of our site visitors and remake our materials and all of those kinds of things too. So we can't implement them the day after they start. That wouldn't be good practice, and we wouldn't be acting in good faith with you.
Thank you, Molly. That concludes our questions, and David, I'll be turning the mic over to you for your closing remarks.
Liz, thank you. First, I want to start by thanking everyone who has participated today and submitting your questions. We're going to review the discussions that took place during this call, the previous call. We've already taken a look at some of that, and we'll be putting that together to develop a response to CEF on this round of review of the curriculum criteria. We also encourage you to continue sending your comments into ASPPH as well as directly to CEF. Please join the online community accreditation review group. There'll be information about that on the next slide. Also, please remember that there will be subsequent rounds, at least 2, probably 3 more rounds of comments. And I'd like to close by, in addition to thanking all of you, thanking in particular Liz and Laura and Molly and Donna and Rick for their participation in the call today as well. I think Liz may have some information on the next slide about the online community. So Liz, back to you.
Yes, thank you. I'd like to encourage all members, so that's faculty, staff, students, and alum, to join the online community. It's the space, virtual space, where we're posting all of our preliminary reports from the subgroups that we mentioned earlier and inviting comments. Can't say there have been a ton of comments yet, but we really need to hear from you if you concur with the reports you see before you, if you disagree, because we're going to be taking your comments and these reports and formulating our draft response to SEAF that will be circulated to the leadership of all the schools and programs. So you just drop me an email, please, if you're interested in joining that online community on accreditation. And then the next slide. So thank you, thank you. We've heard you today. We have profited greatly from the dialogue amongst the speakers and the questions and comments that all of you have had. Already, the archived webinar from 2 days ago is posted on our website per the link at the bottom. And this webinar will be archived and posted as soon as we can get to it. So stay tuned for that. All of you who have joined the session will be, you'll get an email about that new webinar, that archived webinar. And next, we would be remiss, before we sign off, if we do not take this opportunity to salute and thank Rick, Dean Rick Kurz, ASPPH's Accreditation and Credentialing Committee Chair since 2012. Many, many best wishes, Rick, to you on your retirement. We're glad that you're sticking around at North Texas and hope you enjoy the rest of your tenure as a faculty there. And thank you so much. I'd like to thank as well Donna, Molly, Laura, and David for their time on this call today. So thank you all for joining. We heard you, and this concludes our listening session for today.